Welcome to our channel. Today we'll discuss about poverty and inflammation, a toxic cocktail for mortality. Poverty and inflammation, a toxic cocktail for mortality. The specters of poverty and illness have haunted humanity for millennia, their shadows intertwining in a tragic dance of suffering. But recent research suggests these forces might not be merely linked but synergistically potent, weaving a particularly lethal tapestry when they dance together. The culprit? Chronic inflammation is a silent simmer beneath the surface that amplifies the health risks associated with poverty, leading to a significantly heightened risk of premature death. Poverty's grim toll. Poverty is not merely a lack of material possessions, it is a deprivation of opportunities, a suffocating web of stress, and a constant exposure to environmental and social hardships. It manifests in inadequate housing, poor nutrition, limited access to healthcare, and social stigma, all of which conspire to chip away at health and well-being. 1. Nutritional deficiencies. Poor dietary choices and limitations due to cost often lead to deficits in essential micronutrients and antioxidants, weakening the immune system and leaving the body vulnerable to chronic inflammation. This becomes a vicious cycle, as inflammation further reduces appetite and nutrient absorption. 2. Stress and psychological burden. The chronic stress of poverty, be it from financial insecurity, housing instability, or lack of social support, triggers the release of stress hormones like cortisol, which act as pro-inflammatory agents. This constant internal inflammation wreaks havoc on the body's systems, accelerating cellular damage and increasing the risk of chronic diseases. 3. Environmental hazards. Living in polluted neighborhoods, exposure to toxins and substandard sanitation, and limited access to clean water increase the risk of infections and respiratory illnesses, further burdening the immune system and promoting inflammation. 4. Limited health care. Poverty often translates into delayed diagnosis and inadequate treatment of health conditions, allowing them to progress and trigger chronic inflammation as a secondary response. Lack of access to preventive care also leaves individuals vulnerable to preventable diseases that can contribute to inflammation. Inflammation's hidden shadow. Chronic inflammation is not a disease, but rather a low-grade, persistent fire smoldering within the body. It can be triggered by various factors, including the aforementioned consequences of poverty. When present, the immune system remains in a state of hypervigilance, continuously producing inflammatory markers that damage tissues and organs. This chronic wear and tear manifests in a multitude of chronic diseases, including 1. Cardiovascular disease. Inflammation plays a pivotal role in atherosclerosis, the buildup of plaque in arteries that leads to heart attacks and strokes. Poverty-related stress and unhealthy diets further exacerbate this process. 2. Cancer. Chronic inflammation can alter cell behavior, promoting uncontrolled growth and tumor development. The immunosuppressive effects of poverty can also hinder the body's ability to fight off cancer cells. 3. Respiratory diseases. Air pollution and chronic stress associated with poverty are known triggers for asthma and chronic obstructive pulmonary disease, COPD, both of which involve chronic inflammation in the airways. 4. Diabetes. Chronic inflammation disrupts insulin signaling and glucose metabolism, contributing to the development of type 2 diabetes. Lack of access to healthy food and proper healthcare management in poverty exacerbates this risk. The synergistic effect. When poverty and chronic inflammation dance together, the consequences are amplified. Their combined effect is not simply additive, but rather multiplicative, creating a devastating cocktail that significantly increases the risk of premature death. Studies have shown 1. Increased mortality risk. Individuals living in poverty with chronic inflammation have a twofold risk of dying from heart disease and a threefold risk of dying from cancer compared to those without either factor. 2. Weakened immune system. The combination of poverty-related stress and chronic inflammation further suppresses the immune system, making individuals more susceptible to infections and opportunistic diseases. 3. Early onset of chronic diseases. Chronic inflammation accelerates the development and progression of chronic diseases, leading to their earlier onset and increased severity in individuals living in poverty. Breaking the cycle. The understanding of the synergistic link between poverty and chronic inflammation paves the way for targeted interventions aimed at reducing mortality risks. Strategies should focus on 1. Poverty alleviation. Addressing the root cause of the problem is crucial. Policies and programs promoting income equality, affordable housing, and access to education and employment can provide individuals with the tools to escape poverty and its health consequences. 2. Nutritional interventions. promoting healthy eating habits and ensuring access to nutritious food through food assistance programs and dietary education can combat nutritional deficiencies and reduce inflammation. 3. Stress management. Mindfulness practices, cognitive behavioral therapy, and social support programs can help individuals manage stress and mitigate its adverse effects on health. 4. Early detection and prevention. Increased access to healthcare, including regular checkups and inflammatory marker screening, can enable early detection and management of chronic diseases before they progress significantly. 5. Anti-inflammatory therapies. In some cases, targeted anti-inflammatory medications might be considered to manage chronic inflammation and reduce its harmful effects. 6. Thanks for watching.